In terms of our leadership comments, again, making sure that we are as transparent as we have been in the past, giving you the updates as we know it now. And please understand that things do change throughout the day. You know, this week we were presented with a wonderful story from two providers within the primary care. Within primary care and also a physician, and Dr. Roth and Gallery, Nurse Gallery, and both of them had shared with Miss Wedding that they had received a copy of a flag that was presented to one of our POW, our veteran POWs from Vietnam, from President Nixon. They were so moved by this. And I think stories like this will tell us how much our veterans do appreciate us. And I do think it's just amazing that both the nurse and the physician were presented with this flag. Obviously, it meant much to this veteran. So thank you very much. All right, let's go to the next slide, Sean.
Director, I can do this slide if you want. It's just our COVID because it's got a lot on it. This is just our general COVID situational report for February 3rd. We have 3 veterans in house. We're monitoring 67 veterans in the community. Our current bed occupancy is ICUs 5, 7B 19, 8B 20, 9B 9C are 19 and 21, 10B 9 veterans, and 10C 5 veterans. And then just for folks' awareness, if you are in need of a booster, the vaccine clinic is still running every day, Monday through Friday. They're accepting walk-ins. And as of the close of business, we've done over 30,000 vaccinations.
Thank you, Sean. And I do want to add that we are continuing with our 4th mission. And we have been very successful supporting the community with our 4th mission. So let's go to the next slide, unless there's any questions. Okay. All right. So who's review from since the last town hall, effective 1/12/22, we had the adoption of the new masking guidance for veterans and visitors coming into the facility. From what I can see and when I've talked to screeners, it seems to be going quite well. I think that there are a few veterans who may have some difficulty, but they are complying. We've consolidated the employee testing in the vaccine clinic on the 3rd floor A wing, which I believe is helping very much. Incident Command had reviewed the new directive regarding the N95 masks for non-clinical staff, and communication went out working with the union. I appreciate the partnership that went on with that. COVID-19 a reverting of the annual leave to pending ended on January 31st. I know this may have been a challenge for some and difficulty for supervisor, but it was something we needed to do because of our surge, and I thank you, and I'm glad that we are off of that right now. And we had dedicated use of the Northwest employee entrance and exit for staff 6 to 6 p.m. And if people do use the other exit, we have been communicating, but we understand that from the 3rd shift may be leaving, at 7, and so we've been allowing them to do that. I think we have to be as flexible as possible. We are an organization that does not want to cause any difficulties, and I believe that it's moving in the right direction. So let's go to the next slide.
Is that me?
Amy?
Yeah.
Maybe that's you, Amy.
Okay. Hi, everyone. So the procedural areas are back to operations. We do still have some staff redeployed to inpatient areas and on different shift rotations, but that's not impacting our outpatient services, which means based on the moving forward guidance, we are in the staffing category as conventional or baseline. The staff still redeployed do have dates to return, and we are actively reviewing the staff on different shift rotations and developing plans to return them to their normal tours and shifts, and working collaboratively with the union partners to do that. All in all, the wave came in as fast as it went out, and for that I'm grateful. We do have some ongoing issues with staff going out sick. I think we'll have that for a while, and that still remains a concern and something we're watching very closely, but it's much more manageable when it's 1 to 2 staff out on a unit versus 5 or more out on a unit. The other thing I just want to emphasize again is that the decision made to pause and limit services, to redeploy our staff, to change tours and shift rotations, we're strategic and in our effort to preserve the safety of our veterans and staff during this state of emergency. There isn't some covert operations in the background happening where we are, looking to single any staff out or impact the lives of staff just because we think we can. That's not what's happening. If you were selected to be redeployed on different assignments and your tours were changed, that simply means you had the competencies and the skill set that aligned with what the need was in that area. Our greatest risk right now, and I think that goes for all healthcare institutions, is combating the staffing shortage in the aftermath of these waves, which existed before the pandemic and is now much worse. And as you know, the healthcare environment isn't necessarily as attractive as it once was. But although we are meeting our care needs and patient care needs day to day and shift by shift, we do have numerous vacancies on each unit, which makes that a little bit more difficult. But our exec team, again, I just want to emphasize this, has always been champions for safe staffing. And we've been staffing up our units since the spring of 2020. The issue remains that it's difficult to get staff in the door. And most importantly, we need to focus our efforts on retaining our existing staff. And so recruitment and retention and safe staffing remain our priority. But with the help of our new nurse recruiter, Carolyn Scott, and I think with my tenacity and stubbornness, we plan to make a mission out of it, and making sure recruitment, retention, and the in-hiring and credentialing process moves along. I am also fully aware of what our competitors are offering in terms of crisis pay and incentives. And yes, this makes things more difficult and a challenge for us. I will say that in conversations with the chief nurse and senior clinical advisors for patient care services at ONS, there is a focus on pay for nurses and other healthcare workers at the national level. So I do want to just mention that. And again, our priority is to continue applying strategies to remain competitive with the local market. And for now, I just ask everyone to think of perspective, because it certainly helps and goes a long way. As I said in the nursing newsletter, if you were able to read it, the perspective provides a pathway for greater understanding and acceptance. And although we had challenges here in Albany, there are many healthcare facilities in our region and within our own VISN that are still having extreme challenges to the point where they're calling in military personnel to provide supplemental staffing. And our facility didn't encounter issues to this extreme. And for that, I'm also grateful. And now I think it's time that we heal and start to move forward.
Thank you, Amy. Well said. I really like rounding that you're doing with nursing in terms of retention and very good rounding. I happened to go into, I did plan to go into start within the organization again. And to broaden it more, attending to EMS and had very good conversations with them. And we have to remember those frontline employees who are doing much of the work behind the scenes to help us. So thank you. Okay, we're going to still have some opportunities to have infection prevention updates. I think that this is still important. You know, we have to be vigilant, again, you know, listening and watching and observing what's going on nationally. You know, those things that we talked about are still important to practice. So go ahead. Is it Christine? Is it, I'm not sure who's going to be presenting.
That's a good question. I'm actually going to turn the baton over to our new IPs. I know Kelly and Chris should both be on the call. So I'm hoping that one of the two of them are going to jump right on and speak to the infection prevention.
Good morning, this is Chris Antonelli. So one of the things we want to talk about is guidelines for mitigating exposure and transmission while at work. We ask that patients should be encouraged that when they need to wear masks during all face-to-face interactions and report symptoms if they have them. Inpatients need to be asked to wear masks when a staff member enters a patient room. All staff need to be wearing the appropriate mask and eye protection. Eyeglasses are definitely not appropriate eye protection for all of their patient encounters. Next slide. All staff need to wear appropriate masks at all other times, socially distancing during break and lunch periods. Please, if you become sick or symptomatic during your tour, report symptoms immediately to your supervisor. If you are sick or report an exposure, someone from the infection prevention department or occupational health will reach out to you to discuss your specific situation and our recommendations for testing or quarantine. So one of our first updates is what's the process for returning to work after being diagnosed with COVID? So infection prevention will provide the employee and their supervisor with guidance, including the dates recommended for testing. An asymptomatic person or a person with mild symptoms, they have to remain out of work for a full 7 days from the test positivity or symptom onset. So that is day 0 is the test positivity or the symptom onset. The healthcare provider can return to work at day 8. Testing should be performed on the day of the return, but you can test the day before on day 7 to return to work on day 8. Again, testing is done in the antigen testing clinic on the 3rd floor. The hours of operation are Monday through Friday, 6 a.m. to 6 p.m. We are available there 6 a.m. to 9 a.m. and 4 p.m. to 6 p.m. If antigen test is negative, you can return to work. If it's positive, you have to remain out of work for the remainder of the full 10 days of quarantine, and you do not need additional testing to return. Next slide. So update number 2, if you are exposed to someone who is confirmed positive for COVID, notify your supervisor as well as occupational health in conjunction with infection prevention, which can be reached using the VHALN staffing updates. They'll evaluate the risk of the exposure, provide guidance, will place orders for testing if it's indicated. Please do not go to the 3rd floor testing location until you have spoken to one of our departments, either occupational health or infection prevention, detailing the exposure. We want to provide guidance for you. Antigen testing will need to be completed between days 5 and 7 after exposure. Continue to monitor yourself for 14 days for symptoms. Report them immediately. Do not come to work sick. Please have a very low threshold for symptoms. Any questions about that?
So just to clarify as to why we are going out to day 8, that's under conventional staffing. And one of the reasons that we did that is that we found when we were testing people out on day 6 when they returned, I would say 75% of our staff were coming back positive and we were sending them back home again. So now with conventional staffing, we have the, I don't want to say luxury, but we do have the ability to keep people out for that full 7 days quarantined, and then they can return to work on day 8. We are saying that people can get tested on day 7 so that if you happen to work on a Sunday and there's no testing on Sunday, you could be tested on Saturday and return to work on Sunday. So we're trying to put some flexibility into the testing for people when they are returning to work. Any questions on that?
Thank you, Chris, and that's the end of our slides in general. So if there's any questions, if you either want to drop them in the chat box or unmute yourself.
Sean, I don't know if the director's having difficulty as well with her audio or the computer. She may not be able to get back on. Oh,
Okay, and
No, I am on, Amy.
okay.
Yeah, but I can't sign on to this domain for some reason. So I just, I've been talking to Chino, so we'll get it fixed with IT. Not with Chino and IT, but Sean with IT.
and for some reason, when I look at the chat box, all I'm seeing is the folks who've joined. If there's any questions, I'm not seeing any. Just so everybody knows, I'm not ignoring you.
I don't see any questions either.
Okay. Oh, good. Okay.
Okay.
No
Well,
questions.
the intent is to keep everyone. Okay, go ahead.
No, I just was saying, no questions at all from anyone? Okay, it doesn't look like it.
Okay. Well, our intent is to make sure that we're keeping you informed. We will continue with the town halls. I'll also be starting up managers and supervisor meetings, looking at, our shift for the town halls. We'll be doing State of the Union and giving updates where we've been and where we're going and goals setting for the new fiscal year. We have to move forward. I know that employees are exhausted, and we're doing all that we can to ensure that we have engaged and employees who will be able to support them and create a balance within the work and their personal lives. So again, I thank you for joining the call, and I can talk to you, many of you, throughout the day. Thank you. Have a good afternoon, everyone.